So I'm Dr. Kris Mahadeo. I'm the division head for pediatric transplant and cellular therapy. I'm one of the transplant cell therapy physicians within the pediatric department at Duke. We take care of pediatric leukemia, high-risk leukemia patients that would benefit from CAR T therapies or transplant as a definitive cure. But we also take care of genetic diseases like sickle cell disease, thalassemia, primary immune deficiencies such as SCID or chronic granulomatous disease, CGD, as well as the division has a long history of treating metabolic disorders in the transplant division, such as Hurler syndrome and others. Many times when patients come to us for transplant as a cure, they've had the disease that they've been dealing with, and they understand a lot of sort of what the disease means to them. But I like to start often by really understanding what their perspective is and of the disease, what their hopes are. Not only them, but also the caregivers that are supporting them, right? And so we start with that perspective, what that understanding is, and then how do we move forward, and how do we tailor the plan that best aligns with them. And like I said, my focus is always on not just a cure, but sort of that long-term outcome for both them and their families. The most gratifying part of what we do is really being able, again, not just to see a cure of disease, but really the long-term outcomes and what that means, not only to me, but to the patient as well as their families. And that could be, as we work together, it may be going to college, it may be getting married, it may be having the job that they wanted. It can mean so many different things depending on that patient, on the disease that they're dealing with. But seeing that come to fruition, I think, are the most meaningful things, especially when it's happening years later and they're proactively reaching out to let you know that they've been able to achieve that.